Okay, well, thank you. It's a great honor to be here, and we want to welcome everyone from the American Public Health Association to your mid-year gathering. We hope you can bring your whole convention here, 13,000 people. I went to one some time ago in Washington, D.C., and I saw Dr. Quentin Young over here. I think he's 88 now. Isn't that right, Quentin? 88? Yeah. He was sworn in as the president, and I know Linda Murray is the president now, and our state, I signed in January a law that recognizes civil unions, and the next month we next month I signed a law abolishing the death penalty in Illinois. So we would appeal to your membership that states like ours that are doing bold and important things be recognized, because I believe in public health. I think if you take a look at it, over the last century, the last 100 years, the advances in American life expectancy have come primarily from public health measures, whether it's clean water or stopping smoking or watching our weight, making sure that we have good prenatal care, on and on and on. It's public health that really is leading the charge when it comes to saving lives and lengthening lives. And there's a passage in Scripture, if you save one life, you save the whole world. So I'm very grateful to the American Public Health Association and all your members for what they do every day, especially here in Illinois. We have some great healthcare professionals. I mentioned Linda Murray, and we have Terry Mason, who's here, and our Director of Public Health, Dr. Damon Arnold, who served 2 tours of duty in Iraq and did a heroic job helping our service members who are now coming home. We want to make sure that we understand that traumatic brain injury and post-traumatic stress, those are signature injuries of this war, and we have work to do to make sure that all of our service members have decent health care, and always have that. I mentioned Quentin Young. Dr. Young, it was 10 years ago in August of 2001 that Quentin and I were on the Centennial Bridge in Rock Island, Illinois, over the big river, the Mississippi River, and we walked all the way from there to Chicago and Lake Michigan on behalf of decent health care for everybody. And I convinced Quentin to be for universal health care, single-payer health care. I hope you're still for that, Quentin. I hope you haven't backtracked. Because we have to have that in our country. Health care is a fundamental right. It's not a privilege. Everybody in, nobody left out. That's my philosophy. It's regrettable that in Washington we haven't been able to get to the mountaintop, but we're climbing that mountain. And I do think that the law that was passed that I support and we are implementing, we need to do that and do that well. And that's part of my job as governor. I want to thank Mike Gelder, who's our health policy advisor on my staff. He's going to be speaking to your group here, I think, on Saturday. We're, part of the mission here to implement the Affordable Care Act, and it's going to take a lot of work. We've got to do it together. We've got to learn together, collaborate together. But this is very important that we get more people insured, but also we have to work on what we saw a moment ago on the screen there, that we have to have a wellness approach to health. We want to put the caring back in health care. We want to make sure that we prevent bad things from happening in the first place, and that's so much of what public health does. And I believe in public health. I wish our legislature believed as much as I do in public health, because some of their cuts are very short-sighted indeed, and we have to understand that investing in public health pays great dividends. And I did learn that along the road walking with Quentin as we went from town to town 10 years ago. It was in August, 90-degree heat. Quentin happened to be my doctor as well as my colleague walking. I made sure that he covered every step. Some days he'd want to go back the next day and get a little bit ahead of where we were the day before, but we wouldn't let that happen. We believe in honesty is the best policy in Illinois. That's why I'm governor. And we made him go back to where he ended the day before. But as my doctor, he said, you can eat anything you want. This is the Quentin Young diet. If you want to lose 15 pounds, go to Illinois, walk across our state in the month of August, 90-degree heat. Anything you want, you can eat, and you'll lose 15 pounds at least. And that's what happened to me. But we did that for a cause, because we understand that health care is vital to everyday people. But oftentimes there are those in politics who they lose track, you know? They have a lot of other things on their mind. But everyday people raising kids, working jobs, paying taxes, they want to make sure we have a decent health care system, a decent health care for everybody. And that's part of the mission that I have as governor. I know that all of you in this great assemblance have that same mission in life, and it is a lifelong mission. And I do want to salute my good friend Jennifer Granholm, a great governor of Michigan. Now, she's going to be talking to you about this issue, and she's for 8 years served as governor of Michigan and understands, as I do, that the governors oftentimes are the ones who are really on the front line. We've got to work with our state legislatures. We've got to go to Washington and talk to federal officials, but we really have to deliver. And that's what I want to do with you, because I think part of a really good health care system is having excellent public health. And I want to do that with our mission every day, and I wish you well here in your conversation and dialogue here today. Please consider Chicago and Illinois for your next convention, and when we do that, we can make the will of people the law of the land. Thank you very much.